In Medicine and Money today, I am joined by Dr. G. He is the host of Well Now, a show that takes on hot topics in the healthcare industry. So thanks for coming on our show today.
Thank you.
To talk about the opioid crisis. This is a big problem. Now,
Yes,
the numbers are staggering of lost productivity in America. What are you seeing?
What I'm seeing, there's a study came out last fall that the number is $78 billion, and a third of it's in the medical cost that I see as a practicing primary care doctor, and a fourth of it is in lost productivity, in efficiency, and a cost to the communities. Certainly in the billions of dollars.
So addiction is a huge problem.
Yes.
And it's hitting the economy.
Yes, yes.
Now, you are in the trenches with patients, and I think this hits home with a lot of people. What are you seeing? What
I'm seeing, I take patients, care patients in the outpatient, in my outpatient office setting, and in the hospital both. And what I see is we have addictions, which is not a mental failing, but a condition. And we, just traditionally in medicine, we want to help that. But what I'm seeing it's such a difficult problem that they'll come in for their pneumonias. We're trying to get them out of the hospital quickly for length of stay issues and for cost-cutting issues. And we're not fully addressing the heroin addiction or the prescription drug abuse. We see that on there. We talk to them about it. We see this. But also, there's not funding for it.
President Trump is out talking this week about this emergency situation with so many Americans addicted to opioids and heroin and cocaine. So what would be a solution that you see?
Yes, he's talking to the Department of Health and Human Services, Tom Price, actually a doctor, who kind of gets it, and I hope they come up with some solutions for this. I think that one of the solutions, the medical community has to take more responsibility in addressing when they see the patients come in for something, get them started, at least get to the root of their stresses. A lot of times they're on it there's two components to pain. There's a physical component and an emotional component. The emotional component is not really looked into because mainly time constraints, but I think that the patient's in severe pain. But, perhaps with an acute injury, a fracture or something, you may be in it for a few weeks is what's recommended for the opioids, not longer than that. You have to get nosy with their stresses and what's going on in their life. They have family issues, they have financial issues, they have other stresses that you have to talk to them, you have to develop a rapport, and it takes time to wean them off and substitute something else. And I think there's an opportunity here also.
You do?
Yes, I think some entrepreneur out there that there are rehab places that are empty beds now because of cost-cutting measures in the nursing home and rehab environments across America. We have empty beds there. We could fill them perhaps there's a period sometimes to get out of their environment, and some entrepreneur could look at these rehab facilities that are already there and repurpose wards to perhaps treat opioid dependence.
Well, thank you for coming on the show. And maybe somebody's paying attention and they'll get some help today, or maybe start up a company to help the situation.
It's a great idea.
Thanks for coming on.
Thank you for having me.